home network, that they work together. That they work together with two main goals in mind. And those two main goals are keep people out of the hospital and improve their health. And I've got a lot of quality metrics that I won't go through because it's going to be, again, seeing them in a snowy window on a rainy day or something. But I want you to know that this is a patient-centered model that really, in the end of the day, we are going to try to improve care. And we're doing it statewide. We're done with demoing it. We're going to roll it out. But in the process of this, our main goal is to do no harm to the existing care management. We're just really, really working very hard to make it better. And I would say this, that I'm proud of the fact that in order for you folks to receive integrated care, the services have to come together at the local level. One thing that's happened through this project, and I just want to thank the legislators, the governor, and the state agencies have been working on this. We have a very effective partnership between the health department, the Office of Mental Health, the Office of Alcoholism and Substance Abuse Services, the individuals that are working in the AIDS Institute with people with HIV disease. We've all been working very closely and hard to build this program together. So this is not a Department of Health program. This is a statewide effort that's being run by a statewide management team of all of the agencies that represent individuals with chronic behavioral health issues or with medical issues. And I've been working in government for 23 years, most of it on the behavioral health side. It's only been 7 years that I sort of drifted into the health department, and I've never seen this kind of a cooperative effort at the state level, really with a patient-centered focus. I'm very excited about the opportunity for this to change the care experience, and not just to change care management, but to actually change care. So what I hope to come back here and to talk to you the next time you do one of these legislative days about is how many patients with mental illness got assigned to a health home, and how we dropped ED utilization, we dropped inpatient utilization, we started to change mortality rates for people with mental illness through the health home program. That's what we're all focused on. And what would really feel good is if you came up to me afterward and said, you know what, it's really interesting. Since my family member was enrolled in a health home, they lost weight, their diabetes is under control, they've got a psychiatrist who's listening, they've got a counselor who's paying attention to them, and they've got a care manager that helped them get prioritized appointments to all the specialty medicine they needed to take care of problems that might have even been created by the psychiatric medicine they were taking. That would be the measure of success. I think that's what we're all focused on here. I think if it's going to work, it's going to work because each local community bought into this and tried to build it in a meaningful way, and it's going to take the support of patients and family members like yourselves to make it happen. So I'm excited about it, and I hope in the end that maybe you're interested and just piqued, and maybe you're a little bit excited too. If you're interested in detail, if you go to our website, it's at the end of this, there's a link. But if you go to our website at DOH and click on Medicaid, there's a thing for Health Home right off of the Medicaid site, and there's a whole bunch of information about Health Home there. And I want to thank Don and everyone at NAMI for inviting me to talk to you, and I want to thank you for your forbearance here, especially with the slides. So thanks so much for the time.
Basic needs of the people with schizophrenia is medication. It's come to my attention that members of my affiliate, many of them are not getting access to the medication. They go to the pharmacy, and the pharmacy either doesn't have it or isn't getting it. Is anything being done? You say to keep them out of the hospitals, they need their medication. Is your group doing anything to make sure that these people get their medication?
Absolutely. So I think one of the largest concerns is, as part of last year's budget, there was an effort to take the fee-for-service Medicaid pharmacy program and put it into the state's managed care program. And actually, we just got off a stakeholder call on the pharmacy program that we run each week. So if there are actual examples, and we've been collecting these from Glenn and Harvey and others who've been giving us examples of issues where that transition has caused access issues for needed medicine. We've been aggressively dealing with those, and the plans have been very good at it. I think there's, with any change, there's some confusion, and people end up very often, if there's a medication switching, there's now some prior authorization that has to happen, and that very often creates some confusion. But our gold standard here is people get access to the medication they need. So I would encourage you to get those examples directly up through NAMI, and I'd be happy to take them directly from Don and look into them. Even on a patient-specific basis, I'd take personal responsibility for having our pharmacy staff look at that for you.
Fidel, thank you for asking that question, because this is very important. We would like anybody here who has a family member or themselves who's had difficulty during this transition, could they please find either Matthew or myself, because we're trying to pull together some information that we can present to policymakers. We need to be sure people are aware if there's an issue. As you can tell from the presentation, and thank you, Mr. Gregor, the intent here is to do the best that they can for the families and the patients. That's what this is about. And if there are problems, be it medication or anything else, one of the things we can do as advocates is be certain that this information gets to the people who can do something about it. So please, at some point today, I'll be around all afternoon, so will Matthew. If any of you have any examples where there has been difficulty with this, please find us, and we'll write down the information, we'll get it to Greg, and we'll get it to everybody else. Okay, thank you.
Thank you very much. I really appreciate it.
Good job.